hi, do you have a masculine face with a prominent brow bossing? Are you looking for a procedure to reduce the prominent brow bone so that the forehead is running smoothly into the nose, so that the S-shaped curve is a very nice curve without a prominent brow bone? If so, then we can offer certain procedures for you. And these procedures we actually call female feminization surgery, or FFS surgery. We have several types of this kind of procedure, and the most common types are type 1, 2, 3, and mostly we use type 1 and type 3. And I'm going to explain you the difference. So what we actually do is that it's all about the forehead. So once we go to the bone, then we actually are going to shave the bone, and we also can reduce the frontal sinus itself. So there's two types, and these two types, it actually all depends on the thickness of the bone, of the anterior bone plate, which is this thickness, that's what's important, and the size of the sinus. So there are three types. So now I'll explain a type 1 procedure, and a type 1 is actually consisting only out of shaving. So it's shaving only, nothing else, no sewing, no bone cement, nothing. I will draw on the whiteboard what it's looking like. So we're going to explain type 1. And in type 1 we have a lot of bone here in this anterior bone plate of the frontal sinus. So this is the posterior bone plate, so we have the skin, bone, the sinus, this is the frontal sinus, then again we have bone, and then we have the brain. This is the nose. So we have a lot of bone here, so this is a lot of bone here, right here, a lot of bone. So it's more than 4, 5, 6 millimeters of bone is there. So that we actually can leave about 2 millimeters of bone, and this will be the end result. This is going to be the end result. All of this is going to be shaved away with a shaver. So the result will be this. So this will be the result. I still have to draw the skin back, so the skin is still there. So that is actually nice and straight, a good S shape, which is much less prominent and much less masculine forehead. So now we're going to explain the type 2. Type 2 is basically also shaving, but we actually do shave more away. So the bone is almost completely shaved away, and then we're going to fill this up with bone cement. So even if it's more prominent or less prominent, it doesn't matter. The anterior bone plate is removed, and then it's filled up with bone cement. Sometimes a little bit of the bone is replaced, but basically it is shaving plus filling with cement. It's actually a procedure we usually try to avoid, because bone cement in a very small percentage may cause infection at a later stage, many years after the procedure. So usually it's something we try to avoid, but sometimes it is necessary. So usually we do type 1 or type 3. Rarely we do type 2, because that's where we're using bone cement. We're going to explain type 3 now, and this is kind of a very typical example of type 3. In a type 3 we have not a lot of bone, so the bone is quite thin. And why is the bone thin? It's actually quite logical. If your sinus is very big, then the bone is stretched over the sinus. So the bone usually is very thin. So usually the bigger the sinus, the thinner the bone. So obviously we cannot shave here. If we would shave here and we would try to get this straight and straight like this, then we would actually shave through the bone and we would have a hole. And if there's a hole between your eyebrows, basically like this, then the line would be like this. It would be very deforming. So it wouldn't be nice at all. So we need to have another solution. The solution is actually to make a bone flap. And how do we make a bone flap? By making a bony cut here with a saw, and we're making a bony cut here with a saw as well. And then we place this bone backwards so that we have a smaller sinus, still a functional sinus, but a smaller sinus without any bone cement. And that's what we're going to fix after with 2 titanium screws. The end result will be like this. That's going to be the end result, something like this, so that the curve is much smoother, and then the curve is going to be something like this. And that's how we can actually reduce the frontal sinus in a type 3 procedure. Basically, the difference between type 1 and type 3 procedure is actually based on the prominence of the frontal sinus, the prominence of the of the brow bone, and also the thickness of the brow bone. So the thicker the brow bone, the more we can shave. But also, the bigger the frontal sinus, the more there is a need to bring the brow bone plate backwards towards the frontal sinus and to reduce the actual frontal sinus. And that only you can see on an X-ray. So before the procedure, if it's not very clear clinically, then we usually will request the patient to have an X-ray done or a CT scan so that we can see actually the thickness of the anterior bone plate.